a level one nursing student. My clinical instructor assigned me to observe you today.
Hi, Gerard. My name's Heather. Excellent. Feel free to ask me any questions.
Awesome, thank you, Heather. I really look forward to learning a lot of the patient that you're taking care of today. I believe you have the patient in room 620.
Mm-hmm.
Okay, do you have time to give me a report?
Sure.
Awesome, thanks.
Room 620 is Mr. Ryder Kind. He's a 67-year-old male. No known allergies. He's a full code. He presented with a stage 2 diabetic ulcer on his right heel. He complains of increased blood glucose readings for the past 5 days. All of his results have been in the 300s, which is really high. He has been a diabetic for 20 years. He presented with a pain of 6 out of 10. We did administer morphine earlier, and now he's at a 1 out of 10. He's ANO times 4, clear lung sounds, medium fall risk, all pulses are +2, cap refills less than 3 seconds, heart rhythm is normal. His last set of vitals was at 1645. It looks like it was a 98.4 temperature, 76 heart rate, 96% oxygen, blood pressure of 128/70.
Okay.
He did get his AccuCheck at 1645 as well. It was at 290. So we are going to be administering regular insulin today.
All right, thank you so much. I appreciate the report. Do you mind if I ask you a couple of questions regarding the medication administration?
No problem. What questions?
And then if you don't mind, if I could possibly watch you demonstrate administering
Of course.
the medication?
Mm-hmm.
What specifically, or why specifically, is the client receiving this medication, Heather?
It's to control his hyperglycemia that he has.
Okay. What action does the medication have on the body?
Well, regular insulin lowers the blood glucose by stimulating the glucose uptake in the skeletal muscle and fat, and it inhibits hepatic glucose production.
Okay. When should you question administering the medication?
You definitely want to question it if the blood glucose has not been checked or it's lower than 200 units a day.
Okay. Is there a therapeutic serum level?
No, there's not.
All right. What vital signs would you monitor?
You want to get a baseline all sets of vitals. You definitely want to monitor his blood pressure and respirations especially.
Okay. Also, which physiological parameters should be monitored with this medication being administered?
The biggest one's his level of consciousness. You want to assess, make sure he's not confused, dizzy. Check his skin, see if if he's pretty pale or if he's sweaty or dry.
Okay. What interventions do you have to teach the client to ensure the medication's administered safely in the hospital setting?
Well, you definitely want to have him ask the nurse what medication he's receiving, what type and dose of insulin, and where his last injection was, because they don't want to give it in the same spot.
Okay. And what interventions would you teach him at home?
You want to make sure first off that he has the right medication. He has the right type of needles. He has a sharps container to put those needles in. And he knows how to administer the medication and to keep it in the refrigerator if it's unopened, and when it is open, to keep it at room temperature.
Okay. Is there any side effects or potential adverse reactions?
Definitely. Hypoglycemia is a pretty big one. Symptoms of that are tingling in his extremities, tachycardia, flushed, unsteady gait, he's pale.
Okay.
And it looks like he also needs to watch out for any swelling or anaphylaxis if he has a reaction.
All right, that's definitely important to look for. How would you know the medication's effective?
If the blood glucose level is controlled without the appearance of any hyper or hypoglycemic episodes.
Okay.
Any more questions before we go and administer the medication?
No, none at all. Thank you so much for answering all my questions. I appreciate it.
Not a problem at all. It's important to know your patient and the medication you're administering to keep him safe.
I agree. All right, thank you.
Let's go.